Yeah, just a quick review of the Wilson Federer Adult Recreational Tennis Racket. Just a few points I think you need to know about as you're looking through rackets that might help you make a good choice. This is made with an air-light alloy construction, which creates a very lightweight frame. So if you're looking for something that's, really lightweight, this kind of be a good choice. They did also put in these stop shock pads, which help decrease and reduce vibration. And that's really important because every time you hit the ball, you got vibration that travels down the racket, down the handle, into your wrist, elbow, shoulder, and so enough vibration, it starts to could create a lot of musculoskeletal injuries, a lot of injuries. So it's really good. Decrease vibration. The least it gets to your arm, the better off you are. And the grip size is 4 3/8 inches, so that's something else to be aware of. Anyway, overall, I think this is a good, inexpensive racket, and I think it's just, perfect for the adult beginner. So if you're looking around for one, I think this is a good choice. Now, if you start playing a lot of tennis, you end up with a shoulder problem, which is very common. I want to also bring up another quick resource, the 6-minute torn rotator cuff solution for seniors. It says for seniors, but honestly, a high-level athlete could benefit from this program. It's so well done. So your shoulder is a shallow ball and socket joint. So it depends heavily on the muscles to support it. This is not like your hip, for instance. Your hip is a ball and socket joint, but it's a deep ball and socket joint. So it doesn't rely as much on muscles to keep everything in place. Shoulder is totally about muscles to keep it where it's supposed to be, the ball in the socket. And that's exactly what the rotator cuff does. It keeps the ball in the socket. So if you have a weak rotator cuff or you have problems with it, you compromise stability and you set yourself up for a lot of injuries. It also has a good question and answer section. What are the symptoms of a rotator cuff tear? Any arm maneuvers that might indicate I have a tear? What imaging tests are used? Where's it tear at? Are there different kinds of tears? Here's a good one. I have a rotator cuff tear and I'm in a lot of pain. I need surgery, right? Well, the only way you can scientifically answer that question, and this book is totally evidence-based, and each one of these is a study. You take a group of people with rotator cuff tears and you measure the size of their tears. So some will be big, some will be small. And then you run some pain scales, like a visual analog scale. And so you find out how bad are these people hurting. So then you look for the correlation between size of tear and how much they're hurting. Now you would think the people with the biggest tears would be in the most pain, but that's not what these studies are finding at all. They find there's lots of people with big tears that don't hardly have any pain at all. And likewise, they find people with small tears that their shoulder's killing them. And then there's also a group of people that are walking around that have tears that are totally asymptomatic. So because there is no correlation between tear size and how much pain you're in, you really shouldn't go by your pain levels to determine if you need surgery. Anyway, what will happen if I just leave my rotator cuff tear alone? Good to know. You have to look at, so here's a good one. How does exercise compare to surgery when it comes to a torn rotator cuff? So the only way you can scientifically answer that is by looking at the randomized controlled trials. And that's where you say you take 100 people with a rotator cuff tear, and 50 you randomly assign to surgery. The other 50 you randomly assign to a good exercise program. And then you follow them over years, okay? The best ones are years. They usually start out with 6 months, like a year, 2 years. And some of these studies go on a while. And then they find out who did better over time, the people that had surgery or the people that did a good exercise program. So to make a long story short, according to the randomized controlled trials, you're going to end up at the same place, That's according to that. But anyway, so the book ends with the exercise program. There's 3 different levels. So let's say you can hardly move your arm. You would start with the first level. But let's say you want to prevent a problem and you have a pretty high functioning arm so far. You could use the third one. Lots of pictures and everything. It's very well laid out. So you run into trouble, there you go. But hey, you're looking for a good, adult recreational tennis racket? I think this is a good one. So check it out.